Hi guys, welcome back to my channel. I'm Dr. Veena, a full-time NHS GP working in London, and today we're going to go through 5 warning signs of breast cancer. At the end of this video, you should be able to identify the 5 signs that could indicate breast cancer, and I'll also take you through what to expect when you then see your doctor. Number 1, if you are a woman over the age of 30, and you notice a new lump or swelling around the breast area or around your armpits, you need to seek medical advice. This will need to be examined and further investigated. Number 2, if you notice a change in the skin of your breast, this could be dimpling in terms of the texture of the skin itself, or in the size of the breast. If one suddenly becomes a lot bigger or a lot smaller, this is something that also needs to be brought to a doctor's attention. Number 3, if there's any discharge from the nipples itself, this could be stained with blood or pus, or it could have a different kind of texture that you're not used to. It could be green, specifically if you've been breastfeeding. If that happens, you have to seek medical advice. Number 4, if the actual nipple changes in the way it looks or feels, this could be inverted, it could become completely misshapen, or it could have a new rash around it that could look like a bit of eczema. Anything like that that happens around the areola or the nipple itself, seek medical advice. 5, if you have pain within the breast tissue around the chest area or in the armpit that is not really related to your menstrual cycle and it's consistently present for several weeks or several months, you need to seek medical advice. Although we've covered the 5 signs that breast cancer could present with, it's important to say that if you have a positive family history, such as having the BRCA gene or more than one first or second close relative, which is first degree or second degree relative, that have had this condition, you might be already on a screening program annually, or you might want to regularly come and get your breasts examined by a doctor to make sure you're safe. There are rare cases as well where this kind of cancer presents with no signs and no symptoms, and those cases are really unfortunate. It could be where the cancer started somewhere else and then spread to the breast, or it could just be that it was completely undetectable right towards the end. However, if you're aware of these 5 signs, you know you're going to be on top of your health and you're going to be examining quite regularly. Now let's talk about what to expect when you go and see your doctor. If you notice any one of these 5 signs and you take it to your doctor, they may first ask you a more detailed history about your health, about your medical history, your family history, and how you've been. After that, they may examine you. This is going to be a chaperoned examination where they examine the breast tissue, the armpits, the chest, and the back and the spine. They may also listen to your chest, listen to see how well your lungs are functioning, and depending on what they find, they'll discuss the next steps with you. If there are positive findings, you're then going to be referred to a specialist, and you'll also have some investigations done, including a mammogram. I hope this video helped to clarify what you should look out for if you're worried about breast cancer. Please feel free to leave your comments below. I'll do my best to answer them. As women, I would encourage you to regularly examine your breasts. You can do that with the palm, the flat of your hand. If that's your breast tissue, just kind of pressing in into each quadrant and each area to get a feel of what your healthy tissue feels like, so that when you, or if you feel anything that is abnormal or away from the norm, you can identify it a lot easier. I'd encourage you to do that every month just to be safe. Thank you so much for watching. I'll see you in my next video.